G'day everyone, it's Andrew Whitehouse here, and this week we're looking at a topic that's grabbed a lot of headlines, and that's paracetamol and autism. Now, of course, paracetamol is a pain reliever that is often taken to relieve aches and pains as well as headaches. What we've seen, particularly coming out of the US, is a narrative around that taking paracetamol during pregnancy may increase the likelihood that the offspring of that pregnancy goes on to develop autism. Now, on face value, there isn't a huge amount of evidence of this, but what has happened recently is that a group has gone out and done a really big study, very rapid study, to collate all the evidence together to see, actually, can we answer this question definitively once and for all? So what this group did is what's called an umbrella review. And that is a review of all the other reviews that are out there and then collated into one and then actually try to come through an answer. So this was a review of 9 different review studies which collated together 40 different individual primary studies. Now what they found is a couple of things. Firstly, is that the quality of these primary studies is low to critically low, really quite low, and we need better studies that are to actually examine this in this area. So firstly, the quality of evidence isn't strong. Secondly, what they found is that when you analyse the whole of the population together, there is a small increased chance that taking paracetamol during pregnancy is associated with a higher likelihood of that offspring developing autism. However, when they looked at the critical analysis, when they actually compared the rates between these children and then their siblings, what they found is that the effect completely disappeared. Now, what this actually shows is that any link between paracetamol and autism is likely due to background parental and genetic factors such as parental health, genetic predisposition, or other sociological factors. It's not necessarily the paracetamol. So what this study has shown overall is that there is no clear evidence of an association between taking paracetamol during pregnancy and the likelihood of the offspring of that pregnancy getting autism. No clear link at all. Now, if there's any further updates on this, we'll be certain to give you a video, but at this stage, you can be sure there is no clear association between paracetamol during pregnancy and the likelihood of autism of that offspring of that pregnancy.